Welcome to another episode of the Carry Trainer Higher Line podcast. Hey guys, welcome to another episode of the Higher Line podcast. We're in the studio today. It's going to be an excellent discussion, especially for those of you that are into athletics, have ever been injured, have ever laid in bed with a backache, have ever frickin' felt less than awesome. We've got Mr. Tom Betts, and you are an acupuncturist.
Correct.
And what else?
I started as a personal trainer, been a personal trainer on and off for 20 years, kind of transitioned into more corrective exercise, not a physical therapy, but similar work.
Your wife's a physical therapist.
She is a physical therapist. She specializes in spinal cord injury when we met, and now more inner ear vestibular balance stuff than the traditional orthopedic PT.
Interesting.
But yes. And then I started working for a chiropractor, teaching all his pain patients posture and stretches and exercises. Yes, straighten up. And then went to acupuncture school, got a master's degree in acupuncture and Oriental Medicine, went back to school, got my doctorate.
A master's degree in putting needles in people.
You got it.
Get out of here. All right, guys, stick it in, wash your hands.
Wash your hands first.
And then pull it out later.
Yep.
Class is done.
It was 4 years that we squeezed into 3 years, so it was a little more in depth than just wash your hands and stick needles, but yeah.
All right.
We did herbs as well.
Clean it all back.
Yeah.
Herbs?
Herbal medicine as well, yeah. I don't practice herbs anymore, but I did learn
A little.
herbs. No, not that kind of herbs, yeah.
Why did you decide to go the Eastern medicine route over the Western? Because you could have gone and done, like, you're technically a doctor, right?
Yeah. I had no expectations.
I didn't mean to air quote that. That was kind of condescending.
It's true though.
We're real
I'm
doctors.
not an MD.
Now,
I am a PhD in acupuncture, so there's a difference.
Question: do you call yourself Dr. Betts or Dr. Tom?
Both.
Because it always seems like chiropractors call themselves by their first name.
That's true. Yeah.
I was like, oh, call me Dr. Mick, but
Yeah.
like if I was an MD, I'd be like, I am Dr. Shook, you son of a bitch.
Yeah. There is a little bit of a hierarchy.
Mm-hmm.
Yeah.
Can you prescribe people stuff?
I cannot.
Just like Fenugreek tea and smear some chamomile on it?
May make some suggestions like that, but I don't.
You don't even make suggestions for tea?
I like peppermint tea.
I love peppermint. Is that what you're drinking?
I am, yeah.
That's delicious.
Good stuff.
Nice for the tummy. Although I hear it reduces testosterone. Is there any truth to that?
I've not heard that.
I've been told that because I eat some peppermint oil.
Okay.
To look into that. You're the doctor.
We'll see. I'll have to
Dick
look.
joke gun guy.
Yeah.
It is true, though. I've read it. Lots to talk about. Maybe a little bit in this podcast for you guys, but then after, he's going to stick some needles in me. I am riddled with injuries just from abuse. My elbows are inflamed right now from jiu-jitsu. We were talking about it before we started filming. So I'll get firsthand knowledge, and then I'll share with you how that works. But I'm a huge fan of, I don't want to say alternative medicine because it's an alternative to what just we think is normal for the last 100 years, sure. Right? But this stuff is old. Talk about it.
Yeah, between 2,000 and 4,000 years old, depending on what text you look at, and we think it's been practiced even longer than it was ever written about, but quite it's stood the test of time, so to speak. So,
just dig in a little bit. Why would somebody want to stick needles in themselves? And I know I'm being facetious.
That's all right. Yeah. Again, my interest in using acupuncture is for pain, primarily for pain. I treat a lot of musculoskeletal issues, but I also treat headaches, migraines, stress, anxiety, some digestive things. It gets used for fertility all the time. It gets used for side effects of someone going through cancer treatment and having lots of nausea and things. But acupuncture and Oriental medicine is a whole system. It can kind of treat the whole body and the whole package, but again, my interest and where I see the most value for what I enjoy, my passion is treating pain and sports injuries, performance enhancement, recovery after a hard performance or after a hard workout, but additionally, aches and pains that stem from lifting too hard, lifting too heavy, lifting too frequently, working out.
Makes sense. It seems like nowadays it's too easy to go to the pharmacy or to the doc, especially the opioid epidemic, and just eat things to mask pain.
For sure.
And then you get even non addictive substances, you becomes just a habit. I'm going to eat one of these. I've got a hard day coming up. I'll eat a couple of these things or rub this thing on there.
Sure.
Yeah.
I mean, for some people, there's a time and a place for medication. I shattered my ankle. I wasn't going to rub herbs on it and do acupuncture. It needed surgery. It needed pins and screws.
Sure.
I needed narcotics for a little while because the pain was severe after that kind of a surgery. But, you know, the amount of medication they sent me home with, the amount of refills they gave me, you know, I finished taking Norco or whatever it was like 10 days afterwards and switched to Advil, and I had, you know, gobs of this stuff. Once the cast came off, we did start doing acupuncture and did do some herbs, and I think they were impressed with how well things healed. And I don't know if I just heal well or if acupuncture made that big a difference or not, or both, but collectively it doesn't give me trouble. I don't have the kind of that arthritis.
I just heard a big crack.
That was actually my big toe. That was a separate problem.
I don't have any problems. He moves his ankle. You guys can't see it. It sounds like somebody busted a stick.
That was just a toe.
That was funny.
Yeah, good timing.
Maybe you can let me put a needle in that later.
We'll try. We'll see.
Yeah.
You got a big toe we'll work on too.
Stay away from my feet, you creep. The reason I love talking about this, first of all, most of the people that view and listen to our podcast are active people. They train with firearms. They train combatives. Like you guys in the comments, you know, talk about some of the things that you do, and the kind of the overarching premise of our whole brand is to live a long and full life, and it sucks when you're broken and in pain.
Yeah, for sure. It's a group of people in particular in the firearms community, military, law enforcement, firefighters. These are frequently, not always of course, but a lot of tough guys, and they often will just go and be in pain and not reach out for help and not do things that can solve some of these problems. So it's especially a group of people that I really want to help. I think people that put their lives on the line, military, law enforcement, things like that don't get the care they deserve post being in the military, post these kinds of things. And I think there's a lot that we can do without just giving people medications or being too woo-woo either on the other side. But I like
What's
helping people.
woo-woo mean to you?
Too many incense and...
How do you feel, Tom?
Yeah. Feelings are good, but you get too far into it sometimes.
Tom, we do have a hot tub here.
Nice.
That
Sauna too, yeah.
That we'll be using later in the video. Just so people are listening, you're not just some dude. I mean, you did show up to the office here with a folding table in the back of your car, but you work for a significant hospital chain.
Correct.
In the Detroit area. You work with professional athletes. You're not just like some dude that like does this stuff out of your basement.
Correct, yeah. I've been an acupuncturist now for 13 years, started school and have been using needles for 16 years. Again, as we've talked about already, got a master's degree in Acupuncture and Oriental Medicine, went back for my doctorate in Acupuncture and Oriental Medicine as well. There are certifications and courses and all kinds of hours to obtain to quantify and qualify for doing what we do.
It's cool.
Yes.
For all of us lay people that are not up on all the jargon, we're electricity.
Yes.
So let's talk about how this works.
Yeah, so Eastern theory to acupuncture, thoughts on why we do acupuncture is kind of that electrical system. Moving blood through the body, moving what we call chi, and chi has been kind of translated into energy, but some new information is kind of coming out and saying maybe energy is a poor translation of the word chi, and oxygenated blood is potentially more what we're doing.
So our guys from Shift Adapt, that's all.
Yeah.
I mean, that's their. We just had Rob Wilson.
I just listened to it on the drive-in.
Yeah, man. I mean, that is the thing.
Yeah.
We're going to work on the dim mock later, too.
There you go. Yes. We get asked a lot about that.
Do you?
I think there was probably...
You're going to die next week.
Probably some people that entered acupuncture school because
just
they
to
were
learn the
martial
dim
artists,
mock.
and just because of that. Yeah.
That's so cool.
Yeah.
So you're going to have to teach us that.
Yes.
That'll be in our Patreon only
Absolutely.
page. For $742, you can learn the dim mock.
There you go.
But you can't share it.
Absolutely.
Okay,
so
that's interesting. So like people, I guess energy, it may be like this all-encompassing term, but you said oxygenated blood.
Yeah.
All right, so like what's the difference?
Well, we talked about in school, one of the instructors talked about like in movies when someone gets shot and you see them, their energy declining and they're starting to fade away and they're getting weaker and weaker. So we kind of think about the energy and blood going together. And through all of your training and medical training and things like that, you lose too much blood, you lose too much of that vital energy.
You die.
You die. Lights go out. Yeah.
So we've got meridian lines.
Correct.
We've got nerves. Are they the same thing?
I think they overlap a lot. I think what a traditional Chinese acupuncturist talks about meridians, the modern version of things, people are talking
So
more
explain
about
this
nerves.
to the people listening. I just am like, pulling stuff out of we haven't talked about this. I'm just pulling crap out of the thin air that I've, little research
Yeah,
that I know on
several
this stuff.
different meridians. Each meridian is attached to an organ system. We're not physically talking about the heart or the liver or the spleen, but the energetics of the organ. So your liver's job in Chinese medicine is to distribute the energy through the body. It's also, in a Western sense, the filter and holds blood and things like that. But from the Eastern sense, it distributes energy through the body. Your stomach definitely digests food, but it also helps build blood with the spleen. Your heart in Chinese medicine kind of controls your spirit, so your Shen. Shen, yeah. So we would say someone's Shen disturbed. That could be anxiety or depression. Their spirit is kind of disturbed, rather than saying, politely how we might say it in Western sense, someone's crazy or someone's upset or paranoid or whatever. In Chinese medicine, we would say Shen disturbed.
All right.
Yeah. So organ system, meridian, each organ system in meridian has a whole set of kind of rules to it. But these days I probably practice far more kind of a westernized acupuncture than a traditional Chinese acupuncturist.
So back in the day, before MRI machines, and it wasn't even until like the 1600s that people were doing legitimate autopsies to figure out how the parts worked, and there was no microscopes and things like nowadays. How did they figure out these meridians existed? And did they even exist? Or are they just like a theory, or can we see them? Or
I've had people trace out meridians and say, I've got this pain that starts here and runs down here, and they just trace.
I've got that right now.
You did this morning.
But maybe that's just a nerve.
Correct. So it's
So
definitely
what's the difference?
some overlap.
Is this just like one of those things like, I'm going to call it a meridian because it fits with my belief system?
How people came up with the system thousands of years ago is still a little mystic to me. I don't quite understand.
So you can't cut a person open
and see
a meridian.
Correct.
Okay. But like if you're working on somebody, are you finding these meridians with your needles?
Yeah, so each acupuncture point sits on a meridian. You can open up a book and look at the large intestine meridian or spleen meridian and see where these points are.
Okay. So I can't see it, you can't see it, but you believe it's there. So this is like a little faith thing. You have faith that this imaginary thing is in me.
Correct.
Is this where Western medicine, like regular docs, real docs, this is a joke, but you friends of mine that are MDs, you get it. They're over there right now just like,
Sure.
Just joking. I'm going to let you stick needles in me, so I'm trusting
I get paid to stab people, remember.
Wait, what?
That's the whole point.
So I'm going to shit myself on the table and just start sobbing.
We don't know exactly
Never
what's
have
going
a
to happen.
boner again. Ever since.
Maybe have a constant one.
Anyway, so is this one of the reasons like some Western docs push back? I can't see it, I can't quantify it, so then there's no science to it.
Certainly.
Is that like one of the main things?
Yeah, and like we were talking about off camera earlier, the studies that were done early about acupuncture were not strong in their results. And
earlier, like 1980, 1850?
Even when I was graduating school, 2008,
Okay.
not even that long ago, 10 years ago, 15 years ago, the studies weren't fantastic.
Okay.
There was a lot of information that said maybe it's placebo, which is an interesting thing in and of itself. I worked for a chiropractor, surprisingly, was a very evidence-based person, and I listened to a patient asking him some questions about, should I try some acupuncture? I did a little bit of research and found that it may be placebo-based, and the chiropractor said, so what if it is?
If it is and it works, then who cares, right?
If you feel better, does it matter how or why? Do you know how a medication works? Do you know how the dentist is going to fix your teeth, or do you just trust that these things are going to be done at the end of the day? And I was really surprised to hear that answer from him, because again, he was kind of an evidence-based, show me the science guy. But
it's not like doing surgery, like we might maybe do or don't need it. That you're not going to damage the person doing it, or
there's certainly some risk, but the risks are very low. Biggest risk is bruising. You're sticking needles in the skin. On occasion, I hit a vein I don't see. Give someone a bruise, but not every day, not every patient, not every week or even month do I bruise someone. But for whatever reason, they seem to come in spurts. I'll bruise 3 people in a week and then nobody again for a month. There have been instances where people hit the lung, treating trapezius, treating some upper neck pain. I think those are usually untrained
how
people.
deep are you going? I mean, the lungs got to be about that far below. I mean, it depends on, I guess, the person's
The size of the
muscular
person,
structure.
sure, absolutely. I have anywhere from 1-inch needles to 5-inch needles, depending on what we're treating.
You're going to keep the 5-inchers in the bag today.
Depends on what we're treating. So you treat someone
5 inches, Drew.
Yeah. Treat sciatica, as we were talking about earlier. Stick a needle in a butt cheek. The butt cheek's a big meaty spot, especially on some people.
I've got a
pretty deep
housekeeping question that maybe do you reuse the needles?
No.
They
Needles
immediately.
are
I didn't know if it's
single-use
like
disposables.
like medical equipment, if it gets sterilized or something.
Some states may let
a
you
little.
clean needles. I'm not even sure what states do. It's just not worth it to try. Autoclaves are expensive, and the risk just doesn't outweigh the benefits. It's just cheaper to get rid of needles and start
much
fresh
are
every
they?
time. I got a box of needles. It's 1,000 needles. It's probably $20.
Oh, that's super cheap. I didn't know how expensive they were.
Yeah.
And they're just like stainless steel?
Correct.
Is there different kinds of metal?
Absolutely.
So
there are gold needles. I've never used a gold
I was just
needle.
asking, like, is there different metals that are supposed to interact with the force field differently?
Yeah, so there are gold
Force
needles but mostly stainless steel. Almost everything's stainless steel.
Okay. Let's talk about like some of the stuff that you've seen in practice from the perspective of a patient comes in, here's how they're presenting, and then what the result was after treatment, just so that people get an idea of what they can expect.
I still get super geeked out sometimes at how well people respond. I've been doing this for 13 years, and sometimes someone comes in and says, they're limping in, and they tell me their pain's a 10 out of 10, and we do a couple of needles here and there, and they say, oh my gosh, I have no pain right now. And it blows my mind still to this day. Blows patients' minds all the time, but even seeing it all the time, it still surprises me sometimes.
What is happening? I mean, you're putting a needle into the body. How is that fixing something? And then has somebody done this stuff and like put somebody through an imaging machine as it's happening? Like, is there anybody that's done like dye tests or ultrasound or anything like that? And I don't know what test you do, but
I'm sure all those things exist.
I want to see this shit.
Let's go look it up.
Why are we not doing this?
The studies don't. I get bored reading studies. I definitely have had to read studies. I'm glad someone gets geeked out about those kinds of things. I like the treatment side of things as opposed to the research side of things, but I'm glad there's evidence supporting what we do and showing things. And I think Western medicine, so we talked a little bit about the Eastern side of things with meridians and organ systems and the chi and blood flow and things, but the Western side of things, I think Western science has been studying acupuncture for a number of years now, in some extent to try and disprove it. They want you to do surgeries and do medications instead of alternative medicine, but studies are showing that we are affecting muscles which communicate with these nerves and kind of this electrical system like you were talking about, but from the Western side. So we're affecting a muscle which affects a nerve, communicates with the spine, communicates with your brain, turns on and off different receptor sites, releases endorphins and different chemicals in the body that make you feel better, reduce pain, reduce cortisol.
Okay. So how does putting a piece of stainless steel into the body do any of this?
I think we're stimulating things. I think you're stimulating a muscle that communicates with these nerves and spine and brain.
So when you're in school and you're learning about this, what is the concept that you're being taught?
Again, what we studied first and foremost was the traditional Chinese medicine about the meridians, and there was still communication through these meridians, but again, I tend to lean more so on the Western explanation of things just because it's more understandable to most westernized patients. I studied traditional Chinese medicine, but I live in a westernized world. If I talk about qi and meridian systems, some people glaze over, some people start rolling their eyes. It's easier to talk about anatomy and physiology. People do understand that at a easier level.
Okay. So if somebody's like me or like themselves and they've got some chronic pain and they decide they want to see an acupuncturist, how do you find somebody? How do you vet them? Is there like schools that are good, bad? Is there a place like, oh, that guy went to that place, like stay away from there?
I'm sure there is.
It's not well known in the, like when you guys are at the acupuncturist convention, you're not like, there's Bob from XYZ school.
No, I've never really cared where someone studied. I think obviously with school, there's some people that really excel in school. There's some people that didn't do great in school, but wound up being great at whatever their craft is. So the amount of education and practice outside of school is as or more important than the education itself. But yes, there's accredited acupuncture schools. There's board exams and licensure and things just like any other facet of medicine.
So how does somebody, if they're going to search this stuff out, you go to the yellow pages? Some of you don't even know what that is.
Who uses yellow pages anymore? I mean, just a Google search for someone, and then I would like if someone asks me, a relative or a friend in another part of the state, I can't physically see them. You know, what can I look for? I suggest looking for someone that's NCCAOM certified.
What's that?
That's
mean?
our governing board. You have to take a test and certify through them.
What's it mean though? NC.
I don't remember.
National.
Yeah, I don't remember.
I'm gonna let you put needles in me. You can't remember 5 letters or what they mean. I give them $69 a year to keep my name on the list. Yeah. That's all I need to know. It's all you need.
Yeah.
No, I'm with you. So again, what's the governing board?
NCCAOM.
Just look this shit up. We got phones.
National Certification Commission for Acupuncture and Oriental Medicine.
NCC.
We got it. AOM.
Oh, you did it.
We get it. Yeah.
What is it?
National Certification Commission for Acupuncture and Oriental Medicine.
National Certification Commission of Acupuncture and Oriental Medicine.
See, we got there.
They're in Washington, D.C. Let's call them. I'm just kidding.
But you can also look at what training someone's done. You know, I suggest reading someone's bio. Maybe they have some reviews on there. Talk to people in the community. That's always a good thing. Word of mouth goes a long way for what someone's experience has been. You know, I think some people there's lots of different components to being an acupuncturist, and some people are great at the business side, some people are good at the treatment side. We talk about someone's bedside manner. The guy got great results, but he was really, he was cold or dry or whatever. So, you have to find someone that works for you ultimately. You always have to do a little bit of your own research. It doesn't necessarily matter what I say is a good practitioner, or because someone passed a test doesn't mean they're great either.
Sure. So let's talk a little bit about why somebody would see an acupuncturist. I don't go to the dentist if I have a knee ache, right?
Right.
When do you go versus a chiropractor or a massage therapist? Or when are you just being a bitch and it needs to heal? You know what I mean?
There's some overlap with all of those. PT, chiro, acupuncture, massage, there's definitely some overlap. I think the number one reason people seek out almost any one of those is back pain. So sometimes we're all buying for the same patient, but I think I don't work on the bone structure like a chiropractor does. I work on the muscle systems. Primarily, that's what I'm working on, is muscles. So I think chiropractic and acupuncture go real well together. Same, massage and acupuncture plays nice with everybody else. People ask all the time, can I go to my PT session after the session today? Yes, of course. Can I go see the chiropractor today? Yes, of course. Can I still go get my massage? Yes, of course. So, but pain is the number one reason people seek out acupuncture. It's most popular for that, but people also use it for fertility and digestive issues and colds, flus, headaches, migraines, stress, anxiety, depression.
How would it help a cold?
Again, it's not my specialty, not what I'd like to treat, but I think it helps build your immune system. I think it kind of helps get it out of your system quicker.
Okay. How about
ease some of the symptoms of the cold? You can help someone with a cough. You can help someone maybe break the fever. You can help with the sinuses, being the congestion of the head or the headache that comes with it.
All right. How about, you said headache?
Headaches are probably one of my favorite things to treat, actually. Even though I really like working on musculoskeletal stuff, headaches are massive nuisance to people. And headaches are something that I think just respond very well to what we do as acupuncturists. I don't think I've found some magic formula of points to use, but I think it's just something that responds very well. I think I've had tremendous success in treating headaches, minus with concussion patients. And concussion patients, I actually presented to colleagues, why didn't I get the same results? And the kind of the response was concussions just take a lot longer to treat than just a standard headache. But
I see.
Headaches respond real well.
So if somebody comes in, they got chronic headache, pain, I'm sure you've got a series of diagnostics that you do.
Sure.
Do you see like, okay, this guy needs the needle here because of what he's telling me, and this woman, she needs it here? Because you've got like these mental checklists from seeing so many patients.
Certainly. There's, I like to look at the neck. I like to look at their posture, but there's points that if you opened up one of our textbooks that you could look up headaches and it would direct you to certain points, and you're going to filter through and yes, say this point might be better for this person versus this person because of their presentation, but absolutely.
I dig it. What are some misconceptions that the public has on what you do? What are some common things that people discuss or just don't understand?
I think placebo is one of the things that comes up frequently, again, because of some of the way the studies were done early on in my profession or my career, time frame wise. I think depth of needle is one of the misconceptions. Some people think the needles are really deep or really shallow or vice versa. So that's one of the things that comes up often is how deep do the needles go. Probably the number one question I get is how does it work? And number two is does it hurt? So
does it hurt?
Do you want it to hurt?
Well, I don't particularly want it to hurt.
Well, good. Then we'll try and make it so it doesn't hurt.
But I'm saying, does it? I mean, just for people.
The needles are super thin, so they tend not to hurt. Compared to a hypodermic needle, I've actually personally stuffed several needles inside of a hypodermic needle. Now, I took one of the bigger needles like you might use for a IV.
Just to show how the diameter.
Demonstration purposes, yeah. So I stuffed 16 needles inside of a hypodermic needle.
I see.
So they're so thin that they tend not to hurt. It is still a metal object piercing your skin. Sometimes it does still pinch. Sometimes it does still have a bite or a sting to it. But compared to shots and injections, blood draws, things like that, it's very different. A hypodermic needle is a straw to transfer fluid in or out. And these are thinner and solid and no space in between.
Mm-hmm. I dig it. That makes sense.
Yeah.
So you reached out to us. You were going to be at S12 event 2 years ago.
Correct.
COVID hit because of your connection with the hospital system and all the people in healthcare. You couldn't go. Still want to get you out there at some point. What would that look like? What would the people at the S12 event? And for those of you that don't know what the S12 event is, check it out on our YouTube channel. There's tons of information. It's an awesome event where we do tactical medicine for emergencies, traumatic blood loss, things like that. We do a bunch of firearms training, combatives training, breath work with our friend Brian McKenzie, and we're going to add this dude. So like what would people over the course of that 4-day, 5-day event get to learn, see, hear about, etc.?
So we talked about a couple different things. Again, treating some of the aches and pains that come with age, come with being at an event like this, some of the combatives, the repetition of being in a position and shooting guns and tensing muscles to do so, recovery, posture, pain, all kinds of different things that we can go over.
Would you be doing any treatment while there?
Certainly, we could definitely do, at a minimum, some demos. Demos are really easy, but depending on what our time frame looks like, absolutely, we could do some simple things.
So I want to make that happen because I think it's cool to expose people to these different concepts, ideas, help folks understand. I'm a big fan of making our bodies work like they're supposed to.
Yeah, absolutely. I think efficiency is fantastic, and listening to Brian McKenzie and Rob, yeah. I think right on. There's a lot of overlap and things that we can kind of help each other with, and reducing cortisol. But again, getting the muscles to work efficiently. That's one of the things that we'll play with a little bit today. Is try and turn on a weak or inhibited muscle and turn off a tight muscle and show you kind of the difference.
You mentioned cortisol. How can you reduce cortisol? What's cortisol? Why would somebody want to reduce it? Why would they want to increase it? What happens if you have none of it? What happens if you have too much of it?
Cortisol is a stress hormone, and it helps us, but yes, too much is detrimental. So we want to release other endorphins that kind of counteract that cortisol so that we have more of a homeostasis, a balance between those things.
And you can do that with needles?
Acupuncture is extremely relaxing. That's probably the number one statement I get when I put needles in. Some sessions I stay in the room and I treat the whole time. And other sessions, there's times I put needles and I leave the room and someone lays on a table and just gets to relax. But the number one response when I come back into a room to take needles out and ask someone how they're feeling is I feel very relaxed. Whether they came in saying there was a stress component to their life or not, they may have come in for headaches, and I ask, how are you feeling? Meaning, is the headache changed? But the overwhelming response is I feel very relaxed. I think there's several pieces to that, but they kind of jokingly refer to it like an acupuncture bliss. People feel just kind of relaxed, blissed out after a treatment.
Very cool.
Yeah.
Well, that's interesting. I like the concept of trying to dial in problems like that versus just the medication or working through it. What's some horror stories? Maybe not even in your own practice, but like I'm sure in school, professors or teachers had things like what's some like crazy.
Thankfully, I've never seen it in school or in my practice or know anybody that's happened to. But again, a pneumothorax puncturing the lung through there would be awful. I think some other professions that kind of dabble with using the needles, doing some dry needling, some people like that haven't had quite as much training. They've hit organ systems that or like the lung like that. But bruising is the biggest one. I have had a couple people faint. Thankfully, kind of making sure you're aware of it.
Was it fear of the needle, or did you like hit something that shut them down?
No, just a vasovagal response where some people are just terrified of needles and will faint.
That's pretty cool that somebody's that terrified of needles that's a fainter came in. Was it like titration where they were trying to like get used to or acceptant of needles?
I think sometimes there's truth to that. I had a bodybuilder back in the day, and they kind of told us in school, like it's usually the big guys that will faint, not some petite little female. It's the big guys.
There's a guy at my gym. I don't want to say his name, but you know who you are. His name starts with a J and ends with an H. But he is a big, muscular, badass dude, and no needles.
Yeah.
No needles.
Yeah. So treating a big bodybuilder one time, he was sitting up, I was working on his shoulder, and he said, yeah, I'm stuck. But he told me ahead of time, I don't like needles. And I said, nobody likes needles. Nobody enjoys
Oh, no, there's people that like them. You ever use the internet? There's some weirdos.
It's the outcome. It's the outcome they like, usually, not the actual needle.
Okay.
Right? So same, I don't like needles, but I like the outcome. I like what the acupuncture can do for me, but the act of getting poked by a needle is not the fun part for most people.
Okay.
But as I was working on him, he again had told me ahead of time he doesn't like needles, and I said if you start feeling faint or see things closing in, let me know right away so we make sure you don't fall off the table or anything. And sure enough, he started sweating and said he was getting hot and felt his blood pressure rising, his heart rate racing and things. So we took needles out and laid him down, and he was a sweaty mess on my table. But
panic attack.
Yeah, definitely. But he calmed down. I said, all right, well, maybe this isn't for you, or maybe we try again another time. And he said, no, let's do it again right now. I want to go. I don't want to be
a bitch.
Yeah, I don't want to be a sissy about this. So
my words, not the docs.
He did fine second round and was good, but sometimes it's in your head. Sometimes some people have just a response. They have no control over it, and lights just go out.
That's interesting.
Yeah, I've had that happen once as well, where someone seemed fine and they were just gone.
That's cool.
It scared me. Thankfully, kind of training kicked in, and I figured out what to do, but I got scared there for a moment.
Slapped him?
Just laid him back down and rubbed his sternum, and he started coming to, and he kind of looked at me and he's like, oh, I fainted, didn't I? And I was like, yep.
And then you said, if you don't pay your bill on time, that'll happen again in 3 days at the snap of a finger.
We've joked a bunch, and he's like, man, you're really quick with the chloroform. I didn't even see it coming.
Get in my trunk.
Yeah.
That's funny. Does anybody use chloroform anymore?
I wouldn't know.
Sure you wouldn't. Sure you wouldn't. How did you get into this? Of all the things that you could have done with your life, you've told me the story a little bit, but share it with the guests.
Sure. I was having some pain. It came out of nowhere one day after a bike ride, and was having some kind of chest/abdominal pain. And I told my mom I was having chest pain, and we took an ambulance ride. And
you were 21, right?
21 years old, yeah. I had just come back from a bike ride, healthy, fit guy, personal training at the time. Been an athlete my whole life, and kind of this came out of nowhere and blew up my world a little bit. But they said it was acid reflux, and that didn't seem like the right diagnosis, but I was young and they were the doctors, so I kind of trusted that a little bit. And happened a second time, again at a Cubs game with some friends, and started getting the pain again, and took another ambulance ride, and the ambulance driver said, it kind of sounds like you're having a panic attack. And we got to the hospital, they ran some tests and couldn't really find anything wrong again, sent me home, and went and spoke with my primary care physician, and he immediately wanted to prescribe medications, and actually gave me a month supply sample of a anxiety med, and I tried it for a month and said, even if this is the problem for me, this isn't the solution. I didn't like how I felt with medications, and found myself one day just kind of staring at the wall and realized, like, I don't know how long I had even been sitting there, and just said, this is not the right answer, and did a little bit of research and found that acupuncture was good for stress and anxiety and all kinds of different things. So started going for those reasons, but turns out it was a misdiagnosis, and I was actually passing gallstones, which was quite painful, and finally figured that out. But ultimately kind of just fell in love with acupuncture by going to acupuncture and seeing all of the different things that he treated for me. Started going again, thinking that I'm having anxiety, but sprained an ankle, and he worked on that. I was doing a pull-up competition with a friend and kind of kinked up my neck, and he worked on the tightness in that muscle, and it released right away. It was actually Thanksgiving morning, and I was like dreading having the whole family come over and have this kink in my neck and stiff neck, but solved that problem real quick. And
how old were you?
Same 20s, 25.
How many pull-ups could you do?
I think I topped out at 12 or 13 that day.
That's a lot of pull-ups.
It was all right.
That's a lot of pull-ups. Yeah. And there's some kid right now just like, pfft.
Yeah.
That's a lot.
Yeah.
I can't do.
Not with those elbows.
I mean, it's stupid.
Yeah.
It's stupid.
We'll see what we can do.
I'm excited to do it.
Yeah.
What is some stuff that people come to acupuncture for, or maybe think that they're coming to acupuncture for, and it's just like, nah, like, this is not what we need to be doing? Like, is there some stuff? It seems like in any field, chiropractors, I think, are guilty of it. And if you're a chiropractor, don't get mad at me. But like, we fix everything. And no, you don't.
Sure.
And you're just like cracking my back. Like, I need to see a doctor for this, or, you know, I need to see a psychiatrist or whatever. Yeah. I don't, but like, what are some things?
Acupuncture does think of itself as this kind of complete system where we can treat everything, but again, certain things respond better than others. And again, what I through my background in sports and my own interest in understanding anatomy and things like that, I like treating musculoskeletal stuff. I like treating orthopedic pain, back pain, neck pain, joint pain. Those are kind of my favorites. Mm-hmm. Yeah. But I've had patients come for fertility. I've had patients come for neuropathy where their feet are numb post-cancer treatment, diabetics with neuropathy.
Wow.
Stress, anxiety, headaches, migraines.
Fertility caught my attention. Not that I'm infertile, but that's a big thing. Have you gotten results where somebody's come in and they are unable to make a baby, and then they can after you've needled them?
Definitely. I try to refer those patients out as best I can to someone that specializes in that, even just giving...
Is this men, women, both?
Usually women.
Okay.
Women usually, but I don't think I've ever had a man come for...
Okay, so it's usually women.
But they do. I just haven't had a man come for it.
So a woman comes, been trying to have a baby, can't have a baby, you needle them. 120 times? How many times?
The first time I ever had someone come for it was just a few, actually. I think it was maybe 3 or 4, and her menstrual cycle was all wonky, and it was coming too soon and coming too late, and she had been on birth control kind of her whole life that was kind of regulating things, and then her body, without the medication, the birth control, just kind of freaked out a little bit, and we got things to kind of become more cyclical, and shortly after that she got pregnant.
That's cool.
Yeah.
Any other stories like that?
I've had just a couple, but again, it's something that I try to get to refer out to.
What's the weirdest thing?
I had a patient years ago come. He had through a sexual encounter.
I knew it.
Got bent.
He got bent?
He got bent.
So it was stuck bent?
Yeah. Got a little kink in the...
You ever heard of such a thing, Drew? But wait a second. So dude comes in, he says, I got a bent dick.
That's not what he came in and said at all, actually. He came in and said he had back pain. He filled out all the paperwork saying he had back pain. Got him in the room and said, so what happened to your back? And he said, it's not my back. But he didn't even want the receptionist to be able to see paperwork and see what the real cause of this visit was for.
Did you put needles in a man's penis?
I did not. Absolutely not. Okay. Yeah, I stay away from there.
Because I've got a bent dick. I don't. So did you fix it?
We definitely helped with pain. He was actually having quite a bit of pain. The swelling from the soft tissue injury took a long time, and he was, at some point we were having, he was having quite a bit of anxiety about it and depression about it.
All right, that's straight up go to the urologist. You don't mess around with your dick.
He did that as well.
And they couldn't fix it.
I mean, they basically said take these anti-inflammatories and things for indefinitely, and hopefully you'll be better at some point. Thankfully, I mean, it can be severe where you rupture something. He didn't rupture anything. So he did get checked out and make sure nothing was ruptured. But
is he okay now?
I haven't seen him in years and years, but
I would keep in constant contact. I would want to know how this went.
Yeah.
Make a flip book. Yeah. You know, once and be like,
there you go.
Yeah, it'd be right in the reception room where you got the happy customers.
Yes.
Yeah, I gotta help you with you with your marketing. We could do a 1-800. You know, is your dick bent? Call Dr. Betts today.
Yeah, I don't want to be that guy.
And sit you like this. You got a needle and you smile and your tooth goes bling.
Yeah, I actually wrote up his case for school, but again, had the opportunity to actually have that written up in a journal, and I didn't want to pursue. Because again, it's not something I enjoy treating. It's not. I don't want to be known for that guy. I don't want to have 1,000 patients reach out to me for this reason. I'd much rather treat your knee
Dr.
pain.
Betts can't get enough.
Yeah.
Yeah, I got it. Okay. All right.
Knee pain, elbow pain, performance enhancement. I'd much rather work on that.
Okay. Have you ever done a discussion like this, like to the sharing what you do to the public?
Sure, absolutely.
Yeah. What formats? Where would people find out, or see other things that you've done?
I mean, I gave a talk to a Lions Club group in my first year of practice, and
I wasn't questioning what have you ever. I was saying it is. This was kind of the point of my question. Is there? Are you seeing people beginning to accept this stuff?
Oh, for sure.
Kind of where I was going.
Yes, absolutely. I think acupuncture is becoming more and more popular these days, and in large part because of the professional athletes that do it and endorse it and things. Mm-hmm. If you think back to the 2008 Olympics, Michael Phelps came out. He's got cupping marks all over his body. Cupping blew up after that. Everybody wanted cupping. If it's good for Michael Phelps, it's got to be good for me. Maybe I'll be a professional swimmer because I get cupping too. I think Kobe Bryant's come out and talked about acupuncture. I think even Jim McMahon, 85 Bears, he came out. He was having some acupuncture way back in the day for for his eye issue. But professional athletes are looking for any kind of edge they can to step it up a couple percentage points in their abilities to perform. Mm-hmm. And they're looking out for all kinds of things.
Walter Payton did ballet.
Yeah, absolutely.
Mm-hmm.
Yeah. Sports is changing things. People have hyperbaric chambers in their homes. They've got saunas in their homes. They're using dietitians. They're getting massage and chiropractic and PT and acupuncture to really tune that vehicle as top performance as they can.
It seems to me that while we're pushing the limits with longevity, medicine's helping, but people at the same time are also going the other way where we stare at screens, sit in our vehicles, sit on airplanes, we've are so removed from physical labor in these industrialized countries. For the most part, there's still plenty of people that do that stuff. But even people that have physical jobs, as soon as they're done, they're just sedentary and... eat shit.
To me, finding balance is the key. Really, if I could sum up a master's degree, a doctorate in acupuncture, I mean, the yin and yang symbol, people are familiar with the yin and yang symbol.
Is it yang, not yang? It's yang.
Yang, yes,
okay,
correct.
Well, we learned something new.
There you go.
So when people
it's
are
balance.
like, you know, yin and yang, I can be like, you mean yin and yang.
Exactly.
Asshat.
Finding balance. Working hard and playing hard. Working hard and recovering hard.
That's a good way. That's something most of my friends are super into, that mindset.
Yeah.
That's there's a fine line there between damaging yourself and not. And then it seems like as we age, the recovery side, I used to be like 8 hours of play, an hour of rest. Now it's hour of play, 8 hours of rest.
Requires 8 hours, yeah.
Yeah.
I mean, I use a lot of car analogies in my discussions with patients, but a brand new car, it's kind of hard to break a brand new car.
Drew, he's never gone on a road trip with us. Give me a rental car.
Yeah.
A brand new rental car.
Not that you can't abuse something and turn it into junk, but you know, a higher mileage car, you got to be a little bit more. You got to let them warm up longer. You got to take care of them. You got to put different kind of oil in it than a brand new car. So I think maintenance becomes more important throughout your athletic career or your construction career or whatever.
Mm-hmm. Talk about nutrition. How do you feel about nutrition? What is? It seems like a lot of medicine for so long just kind of like looks right past.
Yeah. Again, that's a massive component to health and wellness. If you're putting poison into your body, think about putting diesel fuel in a regular car, or vice versa. Putting regular fuel in a diesel. It's the wrong type of fuel. Even regular fuel, but the difference in the octane versus a high performance vehicle versus a Toyota, right? So nutrition is massively important.
That seems to be the issue, though. What is nutritious? Oh, I ate my Wheaties. Well, it's not actually very good for you at all. But
marketing of products is massive.
Yeah, this fortified cereal that's made of 18 different artificial colors and flavors is part of a balanced breakfast.
How many kids are drinking Gatorade because of commercials, thinking they gotta...
Right, I'm doing myself right, man. Just guzzling this blue goo.
Right.
And so therein lies the question. It's like, do you subscribe to a food philosophy? Like, I've actually got two friends right now that eat raw meat. Their whole diet, not like partially cooked, but like raw, like a dog.
There's a ton of fads within nutrition.
Yeah.
These come and go, keto and Atkins and all kinds of different things. Again, to me, it's about balance. I think eating nothing but steak, I think, might be a problem. I think eating nothing but vegetables might be a problem. Having some balance between all these things is the way to go. I think we talked about earlier drinking some beers. I think, you know, if all you drink is a beer, you're going to have problems. But if you have have a drink here and now and every once in a while, I think that's
What's
balance.
every once in a while? Like 3 to 4 a night?
Perfect.
7?
Depends on the person.
And so, like, what does that mean?
What does what mean?
I mean, what does that mean? Depends on the person. I mean, we've all got a liver.
Yeah. Some people are predisposed to not being able to drink at all. And some people, I mean, how many people do you hear, oh, my grandfather drank whiskey, smoked cigarettes, ate nothing but bacon, he lived to be 104, you know, and other people, a guy trained for marathons, ate nothing but vegetables and had a heart attack at 41.
Right.
So your constitution and the luck
Aren't
of your genetics.
those kind of outliers, though?
Of course. But to me, the balance between those two things is for the masses, because the outliers were able to get away with that, but most of us aren't those outliers. We're in the middle, and we need to be finding some balance between.
What does
those
balance actually mean? I think we toss that word around so much. Like, how do you do a balance? Like, okay, bite of steak, bite of broccoli, bite of steak, bite of spinach.
I think that still is very individual. I think some people can eat steaks all the time and feel fine, and other people, they have a steak and their digestive system gets all wonky and they get constipated and whatever. So
pussies.
For some people,
Drew and I eat steaks.
I like steaks.
Drew and I eat steaks. How long a drive do you have to go home? We'll send you home with some Colorado crap beef.
That would be very nice.
Send you
5
home.
hours.
Okay, it'll stay frozen.
I got a cooler.
Oh, well then perfect.
Even better.
Yeah, we'll send you home with a little bit of meat. Yeah, I think that whole concept, and this is kind of back to like the big picture, of what we accept as proper or good. Like, I've got a balanced breakfast of this bullshit sugar cereal with some vitamin D milk. So I'm getting my vitamin D, and that's good. Or I saw my doctor, he gave me this pill, I'm eating it, so I'm doing the right thing. And I'm not saying that going to the doctor and eating a pill is necessarily wrong, but then that same person or people, maybe they're overlooking 9,000 other things that are glaringly obvious.
I think trying to get some of the basics, making sure you're getting sunlight, making sure you're getting some exercise,
But the sun causes cancer, man.
Some sunlight. You can't just live in it all day, every day.
Devil's advocate.
Yeah, sure. I mean, hydration is super important, but you can overhydrate.
Yeah.
Right? So sun's important for you, but you can become a piece of shoe leather if you sit out there and do nothing but sit in the sun all day long every day.
Yeah.
But just to me, getting a little bit of everything in your life is that balance for me. That's how I try to enjoy things. So,
including like midgets on unicycles with whips and chains.
If that's what you're into, sure, why not?
But therein lies again the question, like a little bit of everything. So people there's so much freaking knowledge and information available that whole concept of balance. Like, I gotta have kefir.
Yeah.
If you don't know what kefir is, try some kefir. I gotta have you don't have ginger in your diet.
Yeah.
There's a lot of people that never eat ginger, and I'm just making shit up. But
some of that again is fad. Some of that, I think the evolution of what we look at and science starts showing us that, hey, these things were valuable and isn't just a gimmick. But unfortunately, there's all kinds of gimmicks. There's always somebody trying to get rich off of what's the next big scheme.
What do you think about CBD oil? Because that cures everything according to the bottle or the Facebook ad.
I don't know a whole lot about it, but I think just getting a sample and rubbing some on a sore muscle and feeling like, hey, things loosened up. I think I think there's benefits to it, but I think there's also a whole bunch of unfounded claims. But again, let's look at some evidence. Let's look at the research on these things. It's tough to decipher all that stuff because there is so much marketing to any one of these products.
That's true. Well, it seems like everybody also humans just want simple, let me buy this thing for $80 and it's going to cure all my crap. Sure. Yeah.
Sure.
It's usually not the...
If it looks too good to be true, it's usually too good to be true, right?
True. Unless it's a Carrie Trainer training event. Or a Tom Betts acupuncture session. Unless you got a bent dick.
Yeah, don't come see me for that.
No. What are some things that you would like the general public to know about you that maybe they wouldn't by reading your bio? Maybe somebody that's going to potentially travel to visit with you. And I don't want to hear the canned bullshit. I really care about customer satisfaction, not that kind of stuff.
I like getting results. Results are motivating to me and the patient. I like that. So unfortunately, nothing works 100% of the time. So if we do a couple acupuncture sessions and we're not making improvement, maybe it is time to try PT or chiro or, a lot of times people find me because they're like, it's this or surgery and I really don't want the surgery. Sometimes, unfortunately, you may still need the surgery. Maybe we can limp things along for years before you need that surgery. Maybe we can reduce the pain, but some things are infixable in that way.
I got you.
I like getting results. That's, again, why I like treating sport and orthopedic things is they're typically acute injuries that we can make a difference in quickly.
I like that. Yeah. How do people find you?
Through Henry Ford Hospital System. You can call the main line through that and ask for acupuncture and find me that way. There's bios and things through the website that way. Through my own social media is one way to find me.
What is it?
Tom_Victory_Betts.
Tom_Victory_Betts.
Correct.
So they can send you a message.
They can, yeah.
Do you ever do any kind of private stuff? Like, could somebody bring you to a facility, to an event, to a training?
Yeah, I've gone to a couple CrossFit competitions and gyms that were having some event, some competition or something like that. Those are super fun, exposing acupuncture, demoing acupuncture. People that are, I get all the time that people say, oh, I've always wanted to try this, but
Yeah.
You know, in an event like that where it's free for someone to come try and just check out, that's awesome.
My wife Sharon's, the company she worked for decades, used to bring a massage therapist in. Would you ever do that?
Absolutely. I think that's another great opportunity for people. And I think companies that care for their employees and do some of those kinds of things, I think that's a great thing for a company to do for morale.
So somebody could get a hold of you and
Sure.
you would get on an airplane, take your bag of needles and...
Sure.
Cindy, come to the cafeteria. Mr. Betts is ready for you.
Yeah, why not?
Broke Dick Harry, head to the cafeteria.
They usually don't announce those kinds of things.
No, I wouldn't. Because the guy we already know fills it out, the paperwork wrong.
Yeah.
My back is sore.
Yeah.
My back needs to be rubbed.
Yeah.
This has been a very innuendo-laced discussion.
Yes,
You're
you
trying
talk
to be all
about-
professional over here?
You talk about inserting things in people, and there's bound to be some jokes.
I can do it without you adding any of that business, but I'm with you on that. I'm ready to try this. I'm happy that you were able to make the trip. I'm hoping to get you to the S12 event. I'm hoping that the folks that have listened, I know we didn't go like deep into some of the stuff. We'll get that in the follow-up video that we're about to shoot, but I'm hoping that you guys maybe broaden your horizon some. I'm always amazed how many people I run into overlook stuff that maybe to me or my friends is blatantly obvious. We're products of our upbringing, the people around us, and like if stuff like what Tom does is not something that you'd try, but you're experiencing some of the things that we've talked about, I would frickin' give it a try. Can people many of the people that follow us here and listen are on Instagram and YouTube. There will be comments. Can they comment?
Absolutely.
Maybe will you respond?
Yeah. Reach out, tag me in things, and certainly I'm happy to answer questions. I think this is a foreign thing to most people, so I'm happy to discuss and answer questions and make sure people are at ease with things before they go try it.
Cool.
Happily.
I'm excited. I'm very excited by how what Drew and I built here has brought people like you across state lines so that we can talk about how to be better and healthier and happier.
We sometimes talk about how the negative side of social media, but absolutely, it's been tremendous in my career. And
I met your brother, got to be on his podcast.
Met some amazing people through social media.
Yeah, for sure. Well, I say we do this. You guys, if you enjoyed this discussion, if it elicited any type of desire to seek out more or just got you thinking about your own health and wellness, leave some information in the comments about what your thoughts are. If you've done acupuncture or had it done, or maybe you're an acupuncturist and you saw the title and were like, hey, what are these knuckleheads going to talk about? Leave a comment. If you are an acupuncturist that has seen a broke dick and have a story to tell, leave that in the comments, because Dr. Betts would probably like to commiserate with you on what you guys are going to do for that journal. Broke dicks and acupuncture. That's the title of the article. No?
Probably not. Sounds like a great title.
Visit our website, carrytrainer.com, for information about classes held throughout the U.S., Carry Trainer apparel, and upcoming projects. You can also email us at training@carrytrainer.com for information about setting up your own private course or speaking engagement. Training@carrytrainer.com or carrytrainer.com. Hey, little brother, what do you think of gunfighter gun oil?
I'm gonna have to show you.
Hey, Steve, what do you think of gunfighter gun oil?
Well, Mick,
Hey, Steve, what do you think of gunfighter gun oil?
well, Mick, I have to show you about that. Gunfighter lube. Baby, I had the gunfighter blues. But then I got me some gunfighter gunfighter lube. Let me tell you about it. Made in the USA. Amazing lubricity. Amazing adhesion, baby. 100% synthetic. But it's gonna last you. Gunfighter, gun oil, baby. Took away my gunfighter blues. I'm still working on it, but you know.
So you like the lube?